Hi, so today I will be doing a TED Talk slash presentation on maternal health disparities. Okay, so first I want to start with the scope of the problem. Today I want to talk about something deeply personal and urgent: maternal health disparities, especially how they affect Black mothers in America. When my mother gave birth to me, she faced healthcare system that didn't always listen to her, didn't always believe her pain, and didn't always protect her. Sadly, this is not unique. In the United States, Black women are 3 to 4 more times likely to die from pregnancy-related causes than white women. This crisis is not due to biology or genetics. It's just due to systematic racism rooted and bias and unequal access to care in hospitals, doctors' offices, the whole 9 yards. So I wanted to now dive into the root causes. There are multiple root causes for these disparities. Systematic racism is one of the largest. Even highly educated, wealthy Black women face the worst maternal health outcomes than less educated white women. This is the result of an implicit bias in the healthcare system. Research shows that Black women concerns are often ignored or minimized. Chronic stress from living in a racially unjust society, often called weathering or wears down a Black woman's body over time. Increasing pregnancy complications, limited access to high quality care, especially in rural and very poor areas and communities, and historical mistrust of the medical system further deepen these disparities. So, because this has been happening for so long, Black people in these certain type of communities have given up or lost faith, and now it's just it's a fact that everybody knows that Black women do not get treated the same as white women when it comes to maternity health care, even healthcare in general. If maternal health disparities are rooted in systematic problems, then our solutions must be systematic too. First, we must address implicit bias in the healthcare. Hospitals and medical schools should implement ongoing anti-bias training for all healthcare providers. Second, we need to support community-based models of care, such as midwives and doulas, especially Black-led organizations. Studies show that doula support lowers complication rates and improves birth experiences. I second this because I do think when Black women lose faith in the healthcare system, they go find Black doulas, which are other Black people who care, who are going to give you what you should be receiving in the hospital. And now, in our community nowadays, we all have doulas. My mother, even with my sister, that is 2 years old, she had a doula, and she said it changed her entire experience from having 4 kids. This was the first time she had a doula, and it was the best experience she's ever had. Her entire pregnancy, even her birth, just because she had someone that looked just like her, that genuinely cared about how her pregnancy went. Studies show doula support lowers complication rates and improves birth experiences. Third, we must expand healthcare coverage by extending Medicaid postpartum coverage up to 12 months, ensuring mothers receive care when it matters the most. Legislation like Black maternal health Act provides a policy blueprint fund, research, improve care access, and addresses social determinants of health. Finally, advocacy must continue. We must listen to Black mothers. We must support Black mothers and believe them when they say they are in pain, or when they know that something is going on with their bodies that they have brought to your attention. We must center their experiences and demand justice. People can say that the times have changed, but in my opinion, it's updated racism. Like it's never gonna just fix itself. Like we have to protest and we have to demand justice, because the amount of Black women that are dying after giving birth is ridiculous. And it's a quick Google search, just to see the difference between Black women and white women. And there's plenty of Black women in the world that you can go out and ask these opinions to, that have had babies. And I guarantee you, they all will have a story for something that had happened to them while they were pregnant or while they were in the hospital with doctors, ultrasound appointments. It all comes together. So today, that was just, a little information for you guys. I have prepared a presentation, which is the preview that you're seeing now. Maternal health disparities. Why Black mothers deserve better. Personal story. When my mother gave birth to me, the system didn't always listen. Many mothers of color share experiences of being unheard, mistreated, dismissed, or dismissed during pregnancy and childbirth. Scope of the problem. Black women are 3 to 4 times more likely to die during childbirth than white women. And one of my sources for that article is the CDC 2022. These disparities persist across income education levels, showing that the systematic issues, not just individual behavior, is the root cause. Black women are 243% more likely to die from childbirth or pregnancy than white women. Again, guys, these are facts. Quick Google search, and every year it changes. And in the past couple of years, the percentage has been going up extremely. These hospitals are gaining all this money, benefiting off of these pregnancies, and these women are dying. And they don't have to. They genuinely don't have to. Root causes. Systematic racism, which I think is the number one cause. Implicit bias in the healthcare system. Limited access to quality care. Chronic stress and weathering. Historical injustice. Now, should a Black woman not receive proper care just because she's poor or she came from a certain area or because of the color of her skin? No, she shouldn't. Implicit bias in healthcare. Implicit bias refers to unconscious attitudes or stereotypes that affect a misunderstanding actions and decisions in the healthcare. Like, for example, a Black woman coming in or after birth and she's telling you that she's in pain. Those stereotypes were labeled as dramatic, or we're doing too much, or everything is about race, when it really is. Community-based care. Doula and midwife support leads to better birth outcomes, reduces risk of complications, especially for Black mothers. Especially for Black mothers. Now, I'm not going to say doulas are just for Black people, because there are many white people, Asian people, many other races that have had doulas, but it all had to start somewhere. These people had started somewhere for a specific group of people who was not receiving the same amount of care there was at the hospital. Expanding healthcare coverage. Extending Medicaid postpartum coverage to 12 months helps detect and treat postpartum conditions early. Funds community programs, improves data collection, invest in maternal mental health services, support social determinants of health. The legislative action. Community advocacy. Activists, healthcare workers, and communities are leading this change. Not even the people in the hospital who are causing it. Black women birthing justice. Saving Black mothers' lives is not just racial. It's justice. And as you can see, these are all my references and sources that I have found for this presentation. Thank you so much for listening to my TED Talk on maternal health disparities. Thank you.